I'm showing you this punching bag not because I like boxing, but because I'm talking about epididymitis. Epididymitis is a problem of these small tubes that sit on top of the testicle. So you have the testicle, then you have these small tubes on top of the testicle called the epididymis. When the epididymis gets infected or inflamed, it causes a continuous ache to the testicle. This is a picture of the scrotum, two testicles, the tube that takes spermatozoa from the testicle. It goes through this bend, multiple bends, and then into the seminal vesicles and into the prostate. This is where the spermatozoa mix with semen, and then it just stays there until ejaculation occurs when it comes out. So how does this thing get irritated? It gets irritated from trauma and from infection. We'll start with infection. Since we talked about ejaculation, things go out, but they can also go in through the penis back into the reproductive organ. And that's a sexually transmitted disease. So the common ones are easy to take care of. They usually don't cause scarring to the epididymis, but it can lead to big problems, so you still have to be using a condom and or be monogamous. But bottom line is that when these tubes get infected, the bacteria in this area, sometimes it's real stubborn, so you need antibiotics immediately. You'll notice that when you have an infection, you'll have other symptoms that come up usually, like discharge, burning when you pee, but in some cases it's just the ache. In a small study, there was the suggestion that if you had a bacterial infection in the chest, in the sinuses, in the urine, somehow that bacteria can end up in the epididymis. If it ends up in the epididymis, you technically have a non-sexually transmitted infection, but you still have to treat it with antibiotics, because when any tube, any tissue gets infected in the body, it tends to swell up. That's the inflammatory reaction. When it swells up, it becomes painful. When it becomes painful, it doesn't fit into areas properly, and any more trauma will cause it to become persistent. So the important thing is to see a doctor immediately. Doctors can usually tell by physical exam that it's epididymitis and not say a hernia. A hernia is when through the groin, if this is the picture of the scrotum and the penis, through the groin they'll have the inside lining of the stomach, the abdomen, come through and kind of irritate or press on the testicle, and that's usually found with a hernia check. Both sides. Hernia checks are typically those exams where you have a doctor say, turn your head and cough. And what we do is we put our finger in here and we look for the feeling when you cough. You increase something called Valsalva maneuver. You increase pressure in the belly, and if there is a sac of tissue that wants to come down, it'll come down when you cough. The reason we say turn your head and cough is because doctors don't want to be coughed on. That has nothing to do. So turning the head has nothing to do with finding the hernia. Now, if their doctor has ruled out the possibility for a hernia, he might still, especially if you're younger, want to rule in a testicular torsion. If the testicle is twisted, that means the blood supply is also twisted. When you twist something tight enough, you choke off flow. So if you choke off the blood supply, you actually will destroy this and get gangrene. So it is important for doctors, for you to see the doctor just to rule that possibility out. You have to get an ultrasound to rule that out. Real easy to do, and it immediately tells you that there is a problem, and it's usually going to be swelling, epididymitis. If it is that, again, we give antibiotics. Depending on who you are, what age you are, what other problems you have, it'll be between 10 days to 21 days. And then we do no further damage. So when the tubes are inflamed, when the epididymis is infected and inflamed, it's swollen, and your normal activity of jogging, riding a bike, plyometric exercise will cause this to get really irritated, so you have to have some support, and you have to stay away from activity like that, including sex. So usually that's for the life of the infection, and in some cases to bring down the swelling quickly while you're waiting for the bacteria to die and the infection to reverse, use anti-inflammatories. Now in this case, antibiotics are really important, and I don't think you can get by with using herbal substitutes. I would go straight to prescription anti-inflammatories. But antibiotics, but anti-inflammatories is a different case. You can use anti-inflammatories in the form of prescriptions, over-the-counters, or I think still turmeric, omega-3 fish oil, and anti-inflammatory diet are very important to maintain, so it would be wise to do your best with that. And again, all Americans, as you've seen in any of my videos, all Americans really should be on an anti-inflammatory lifestyle. So that's, in a nutshell, that's so to speak. In a nutshell, that's an epididymal infection. If it is trauma from getting hit to the area, repetitive damage, trying plyometric exercise out and you haven't tried it before, that repetitive bouncing up and down can cause irritation. If it does get irritated, you hold off on any further damage. You support with either briefs or an athletic supporter, no cup necessary, and then you get on anti-inflammatories. So the difference between an infection and inflammation, though, that's up to the doctor to decide. Sometimes an ultrasound does help. Doing both together, it's not going to hurt. If you ever have to kind of take a shotgun treatment approach because you're suffering too much and you just do both, anti-inflammatories, protection, and then antibiotics, not a problem. But if you have to do antibiotics, you should always do a probiotic course of 30 days at least to rebuild the gut flora that we kill off. So that is usually what happens with regards to epididymitis. If you have persistent pain, that shouldn't be, and further possibilities should be investigated, like a prostate infection. Or there's something called sportsman's hernia. You don't feel it when you check for it, but in some sports medicine circles, sportsman's hernia, the pain that you get in the groin or testicle can be reversed by surgically putting in mesh. It's kind of a weak theory, and it does open you up to having surgery, but as a last-ditch effort, I did have a very high-profile soccer player do that because he had to get back in. He couldn't go back to playing, so we tried it. Unfortunately, it didn't work for him. He still had pain, and that was a major surgery he went through. So you have to be in dire straits to have that kind of surgery or that kind of consideration. But that's a diagnosis of exclusion. If we cannot find any other reason, and all else fails, then it would be worth it. But again, that's what you have to go through a doctor for, and a trusted doctor, to listen to your symptoms and to come up with a plan.